So the Paragon HF trial is a long-awaited trial looking at patients with heart failure and preserved ejection fraction, HFpEF, using sacubitril valsartan, or an ARNI. Sadly, the overall impact of ARNI in this patient population in HFpEF was a neutral effect. Yet again, this patient population didn't have an effective therapy shown. The investigators did make two comments about two subgroups. One, women, which I'm naturally very interested in. Kudos to the investigators who enrolled 52% of women, and also patients with a lower ejection fraction in the range of the low 40s and high 40s and early 50s. Normally we would ignore subgroup analysis, or at least just know that we should ignore it. But in HFpEF, there's a lot of evidence to suggest that there are subtypes of HFpEF. So if there are legitimately subtypes of HFpEF, it may be legitimate to start looking at the impact of subgroups. So I think we need to learn a lot about individual patient analysis, and maybe there's a signal that some patients with HFpEF will benefit from ARNI. I think we're in trouble if we're only using a bifurcation of ejection fraction. Ejection fraction is not a precise tool. The value can change on a day-to-day basis. So I think we're in trouble if that's how we're going to decide to use ARNI or not. And I think we've got to look at some other parameters that will help us decide.